Welcome to your surgical critical care rotation. We're excited to have you on this service, which includes residents from 4 different departments and attendings from anesthesia, surgery, and emergency medicine. On this rotation, you'll take care of a variety of surgical patients, learning the perioperative management of surgical patients, including but not limited to complex thoracic, vascular, and trauma. On this rotation, you'll learn the medical management of these critically ill surgical patients. You will also learn common bedside procedures, such as venous and arterial catheters, thoracentesis, intubation, bronchoscopy, and even bedside tracheostomy. You'll also learn how to work on a multidisciplinary team, with an emphasis on effective and fluid communication that will be important no matter your specialty. Finally, you will learn how to apply ethical principles in the context of critical illness and end-of-life care. Now let's talk about the expectations and roles for this rotation. Oftentimes in critical care, treatment can take weeks or even months. That's why it's so important to get a bird's eye view of each patient's ICU course and plan of care moving forward. On the day before you start, we expect you to contact the daytime resident for sign-out of the overall plans for all patients, whether it's a Sunday or a Wednesday. You can do so by calling the SICU phone. You should get a high-level overview of each of the patients and an understanding of their overall hospital course. If possible, you can also determine patient assignments, so you know which ones you'll be primarily taking care of in the morning. Weekday shifts are divided into 12-hour days and nights. Weekend shifts are 24-hour call shifts, unless otherwise specified as an exception. When on service, you'll be primarily responsible for up to 4 patients, but your number of patients will be subject to change based on the needs of the team. At the start of your clinical week, and upon admission of new patients, you'll be assigned your specific patients. You'll be responsible for pre-rounding, formulating plans, presenting on rounds, writing notes, managing patient care, and communicating with other services and family. Things can get pretty hectic on service, so make sure to be familiar with all SICU patients, even if they're not your primary patient. During the day, you'll receive sign-out at 6 a.m. and then pre-round on your patients. Rounding starts with joint trauma rounds with the trauma surgery team, usually at 7:45 a.m. After rounds, the team meets in the workroom and creates a list of tasks to get done during the day. The rest of the day is spent finishing work, doing procedures, writing notes, admitting new patients, and attending didactic meetings. If there are multiple residents on during the day, and all work is done, and there are no pending new admissions, occasionally one resident can sign out to the other to go home early. However, this should be the exception and done only after consulting with the fellow or attending. Otherwise, sign out to the night resident happens at 6 p.m. Residents will present patients by organ system. Please review the guide on the expected presentation format. The presentation format is also posted in the workroom. If you have any questions, the MPs are a fantastic resource on the preferred presentation style. Overnight, you will receive sign-out at 6 p.m, after which you are to pre-round on all SICU patients. At 8 p.m, you'll round with the attending on both SICU and CT ICU patients, starting on the east side of 7 ICU. You'll present SICU patients during rounds, focusing on active issues requiring monitoring and management of these patients throughout the night. You'll also be able to manage unstable CT ICU patients as requested by the attending or fellow. You'll admit new SICU patients and manage these new admissions throughout the night. When on 24-hour weekend call, you'll receive sign-out at 6 a.m. and formally round between 7:45 a.m. and 8 a.m. as usual. Depending on how active the SICU service is, the SICU attending will sign out to the CT ICU attending between 11 a.m. and 6 p.m. After this time, be sure to communicate any significant changes to the patient condition or new admissions to the covering CT ICU attending. The CT ICU attending signs out to the overnight attending at 6 p.m. and evening CT ICU and SICU rounds start at 8 p.m. SICU patients are generally located on 6 and 7 ICU, although occasionally they may be in PACU or 8 ICU. While we are caring for them, we are the primary team, meaning that we write all their orders with a few exceptions. We are the first point of contact for the bedside nurses for any issues that arise. We of course closely communicate with the surgical teams, especially for larger decisions, but any of their recommendations need to be communicated with us before being implemented. As mentioned previously, there are a few exceptions when we allow other services to change orders in Care Connect, but these are only in special circumstances, and in all cases, our team needs to be aware of the changes so we do not duplicate orders. For transplant patients, the transplant service will order all immunosuppressive medications. When the pain service is following a patient, they order all pain medications and all other changes should be run through their service, regardless of the time of day. Occasionally, a trauma patient with both head and body trauma will be followed by both SICU and neuro ICU services. In these circumstances, it is extremely important to clarify who is primarily managing the patient. It is also very important to reconcile our management goals and concerns and communicate directly with the neuro ICU team. There are two phones. The NP carries the main line, extension number 79992. This is the one that most nurses and physicians expect to be carried at all times. At night, only one phone needs to be carried, so the one that is not being carried can be forwarded to the other phone. Each of your primary patients, please provide your VoIP phone and pager number to the surgical teams and bedside nurses every morning. Of note, nurses have been advised to page for non-urgent issues and only call you for urgent issues. As non-urgent calls and pages can be disruptive during rounds, nurses have also been advised not to call or page from 7 a.m. to 10 a.m. for non-urgent matters. If this becomes an issue, please notify your attending. Our team should also attend critical traumas and code blues on surgical patients at all hours of the day. Here are a few tips for residents on the rotation. First, we round with the bedside RN so they are aware of our plan and goals for the day. In general, most clinical decisions should be run by the fellow and attending. We make extra effort to keep the primary surgical teams and neuro ICU teams updated of any clinical changes. Finally, successful residents will use our two NPs as resources. Jenny Correa and Christine Quinn are extremely experienced in critical care. We expect residents to treat them with respect and utilize their knowledge not just in medical decision making, but in navigating the hospital system. There are two other protocols worth highlighting. The first is the ICU bundle consent, which must be signed by every patient or surrogate once the patient is stabilized. Although this covers many procedures, you don't need to go through the risks and benefits of every single procedure with the patient. Rather, explain that we plan on discussing each individual procedure with them prior to performing it, and that this document prevents us from having to sign paperwork for every single procedure performed. The second protocol is the need to reconcile and review orders for patients arriving from a procedure area. Patients coming from the OR have orders placed by surgeons that are signed and held. Nurses should release these orders, and then one of the SICU team members needs to review the orders for accuracy and replace any necessary ones, such as orders for presses and sedation that are often missing. Our NPs can help you with this. Speaking of patients coming out of the OR, there is a formalized process for transferring care from the anesthesia or procedure to the ICU team. We expect a member of our team to be present for every patient returning from our procedure. In addition to bedside teaching, attendings and fellows will provide weekly lectures on the Resident Core Content series. SICU attendings and fellows will give this lecture on Tuesdays from 1 p.m. to 2 p.m. in the Ronald Reagan Medical Center, 3rd floor conference room, number 3309. Zoom links will be provided prior to the lecture. On Fridays, from noon to 1 p.m., the MICU attendings and fellows will give a core content lecture. Zoom links will be provided prior to these lectures also. During these lectures, the MP or fellow will hold the resident VoIP phone. In addition to the core content series of lectures, residents are encouraged to attend other didactic sessions as clinical work permits, such as Journal Club on Mondays from 3:30 to 4:30 p.m. and ICU Fellow lectures on Thursdays from 3 to 4 p.m. From all of us on the SICU team, we're really looking forward to working with you, and we are confident you'll find this rotation educational and enriching.